I'm Kelly Warner. Before COVID-19 led to a stay-at-home order and social distancing, Willamette Valley Cancer Institute was preparing for the impact of a potential health crisis. To protect its high-risk patients, the Cancer Center has made significant changes to its day-to-day operations, and it's improving its ability to protect its staff by creating an innovative way to sterilize and reuse N95 masks.
This is far outside of the box of what I really thought I'd be doing as a radiation oncologist.
Thinking outside the box is what led Dr. Emily Dunn and the medical physicist team at Willamette Valley Cancer Institute to create a special box where N95 masks can be decontaminated using UVC lights.
And what they are is they're a weak form of radiation. So they are still radiation, and they can cause damage to virus particles and bacterial particles.
The N95 masks are hung on a rack between two towers of UVC emitting bulbs and encased in a box with aluminum flashing to ensure that the entire surface of each mask is exposed to the rays. It's a highly controlled environment to ensure the radiation is dosed properly and used safely, and should not be attempted outside the clinic setting.
So what this process could potentially do is decontaminate an N95 mask for reuse by the same healthcare provider. We do think that it's potential to ease our clinic's stress and our ability to keep our healthcare workers safe, which then provides an ability to keep our patients safe, is really invaluable right now.
We feel a huge obligation to our patients to make sure that this is a safe area.
Practice Director Debbie Piccolo says Willamette Valley Cancer Institute has made significant changes within its clinics in Eugene and Corvallis in response to COVID-19. In addition to limiting visitors and guests to protect patients from additional exposure, temperature checks are required of anyone entering the building. The number of chairs in the waiting rooms, the lab, and the infusion room have been reduced to provide 6 feet of social distancing.
We have our infusion nurses, our lab techs, and our radiation therapist all in full PPE every day, which is gown, gloves, masks, and goggles.
Staff who can work from home are doing so, and many patients are seeing their doctors through telemedicine visits. Taking these types of precautions is the new normal at the Cancer Center, as the practice continues to assess what's happening now and what's ahead.
We're going to do everything in our power to make sure that none of our patients get sick, and none of them get sick because they came here.
Last fall, Dr. Jeff Sharman, WVCI's Director of Research, led a clinical trial that earned FDA approval for a blood cancer drug called Calquence. Now, that drug is showing early promise in treating patients with COVID-19 who are on ventilators. Learn more about that at OregonCancer.com. I'm Kelly Warner.